The California Board of Nursing announced, "Attention! All licensees with a furnishing license are required to discuss the following with patients of all ages before dispensing opioids: the risks of addiction and overdose associated with opioid use, the heightened risk of addiction for individuals with mental health or substance abuse disorders, and the dangers of combining opioids with benzodiazepines, alcohol, or other central nervous system depressants."
To implement safe opioid practices, prescribers should follow evidence-based protocols, thoroughly assess each patient's risk factors, review all concurrent medications, and document clinical decisions and patient education in the medical record.
Medication reconciliation involves systematically verifying the patient's complete medication history, including all prescriptions, over-the-counter drugs, and supplements at every visit. Use a standardized checklist to confirm medication names, dosages, and frequencies, and to identify any potential opioid interactions, especially with high-risk agents such as benzodiazepines and muscle relaxants. Pay particular attention to central nervous system depressants and document any identified risks or necessary interventions.
Create targeted counseling sessions in a private, supportive environment for open discussion. Set aside dedicated time, typically 5 to 10 minutes, to clearly communicate the risks of combining opioids with any identified interacting drugs. Educate patients on the signs of overdose or increased sedation, such as extreme drowsiness or shallow breathing, and ensure they understand these risks. Encourage shared decision-making by discussing when to seek emergency care and involving the patient in planning for safe opioid use.
Provide patients with written materials and digital resources about opioid safety. Make sure to distribute easy-to-read handouts that clearly summarize common opioid interactions and offer practical, safe use tips. Additionally, guide patients to reputable online tools and resources, such as the FDA's Medication Interaction Checker, so they can access accurate, up-to-date information on opioid use and safety at home whenever needed. Accessible, reliable information empowers patients to use opioids safely and responsibly.
Make sure electronic health record alerts are enabled to proactively monitor for opioid-related risks whenever these medications are prescribed. Always review and respond promptly to any EHR notifications about contraindications or potential drug interactions. Thoroughly document all patient education and responses to alerts in the EHR. This demonstrates compliance and helps protect prescriber from liability.
Establish a structured follow-up monitoring plan for patients on opioid therapy. Schedule regular check-ins, either in person or via telehealth, to reassess pain management, monitor for signs of misuse, and evaluate functional improvement. Review medication adherence and reconcile all current medications at each visit. Encourage patients to maintain an accurate medication list and bring it to every appointment for review. Implement risk mitigation strategies, such as prescription drug monitoring program checks and urine drug screening, as appropriate.
Engage in interdisciplinary collaboration by coordinating care with pharmacists, pain specialists, and addiction counselors. Open communication and shared responsibility among healthcare teams are essential for ensuring opioid safety and optimizing patient outcomes.
By integrating these steps into routine practice, clinicians can safeguard patient health, reduce adverse events, and fulfill their legal responsibilities for informed consent. For more educational videos, visit www.advancedpractice.io. Follow and subscribe to this channel.